Hello, how are you? Salamun alaikum, namaste. کیسی هو؟ اهلا و سهلا. Hole. How are you, everybody? I'm so happy to see you all. Thank you for following us in our YouTube channel, and thank you for your nice comment and suggestion in our feedback and suggestion box. Today I want to talk about water births, as you asked me that how we are managing and how we can work as an individual midwife for water birth. I know water birth is such a such a big issue in some countries. Some countries working according American College of Gynecology protocols, and that's why they're not that much familiar with that water birth. But some countries that they are following Royal College of Gynecology and Royal College of Midwife, they believe more in water birth. For water birth services for individual midwife, we have some special boundaries in some countries that they don't provide birth in birth centers. Yeah, because some countries they conduct the birth just in institutional and in the hospitals and supervised by gynecologists. That's why it's not possible to follow water birth with those protocols. As you know, the Royal College of Obstetrician and Gynecology and Royal College of Midwives support laboring in water for healthy women with no complication and low risk pregnancies. And the evidence to support underwater birth is less clear, but complications are seemingly rare. If good practice guidelines are followed in relation to infection control, management of cord rupture, and strict adherence to eligibility criteria, these complications should be further reduced. So as you know, that lying in warm water gives a sense of relaxation and feel mother so much calm. But whether it actually reduces pain in most of times for mother, certainly. A perception of relaxation, pain relief, ease of movement, and more holistic experience made labor in water a popular choice during those decades. This concept has been extended to include actual birth underwater, widely quoted experience from other countries like France. So I want to explain about how other countries are trying to administrate water birth and how they could get access to the best practice. As you know, many maternity units they were working on birthing pool, and they could increase till 64% of birthing pool with 20 units and or more than 2. So there is many good data and current data that shows how much their successful birth increase, and they have report of incidents or neonatal ICU report even less than 1%. As all of you know and believe like me, because most midwives believe on that, laboring in water sometimes is very beneficial even we cannot manage birth in the pool. As you know, the benefits and the reduce of the risk in immersion in the water birth, it makes the active phase of the labor very smooth and very gentle. As you know, the benefits of using immersion in water during labor, including less painful contraction and less need for pharmacological anesthesia, and reduce and make labor shorter, it make the advantages more highlight for us. Most of the mothers who follow their labeling in water, they need less augmentation. But it depends. Sometimes, for example, if mother goes very early to the and immerse in the water in the early phase of labor, it's not advisable. Sometimes it's reduce the speed of progress. That's why we have to consider and we have to observe which mother is proper for labor in water or water birth. Yeah, the mothers who follow labor in water, they need less analgesia and they will look for less epidural, spinal or paracervical analgesia. Anyhow, we have to think that what mother needs. And what important thing that we have to think about that if she wants to have birth in water, we have to speak with mother and partner about benefits on water, and sometimes there is some reason that she should not go through birth in water. For example, I will explain to you that which condition we have to consider and we have to consult before with mothers, that she keep in her mind if some condition like that happen, we are trying to remove her from the water and make her to stay in the land for her birth. As you know, we are having many studies, and these studies shows there is no incident in water birth more than land birth. So it is all proved and all evidences has recorded. But according what most of the midwife asking that how we can monitor the baby in the water, there is some special oscillation that we can use in some latex and keep observing and monitoring the baby heartbeat inside the water. But sometimes if you want to use some other medicine or remedies for the mother and its needs, in continuous fetal heart rate monitoring is not advisable to keep mother in the water in long time. The other important things that comes to my mind, it is about the pool temperature, the water temperature. Sometimes I've seen in some places they use very warm water for the mother and the labor room becomes so much hot. Mother cannot breathe and she's sweating continuously and gets so much exhausted. She will not have any more energy to move in the water and she doesn't feel that much active in the water. So we have many controversies about temperature of the water. Some practice they say the temperature of the water should be more than 38 degrees. But most evidences prove that the best temperature for the water is the mother feeling, according to mother feeling. If mother feel comfortable, she doesn't get dehydrated, she doesn't get exhausted, so that temperature is good. So according mother's feeling and her comfort, we will check the water temperature. Plus about pool, we have different kind of pool and tap. There is some latex pool and there is some tap that is fixed in the hospital. So it should be cleaned completely and it should be all of the disposable material should be available in access of the midwife. Plus they should have a midwife, accessible midwife only be for water birth. The most important thing for water birth is that the midwife should be with mother from her antenatal classes, because the midwife knows the mood and feeling of the mother and mother should get used to her. So don't forget, if you want to candidate any mothers for water birth, try to be more emotional attached with her, to feel her feeling and her times situation. What is the benefits for waterbirth? There is many benefits for waterbirth, as I told you, about being relaxed, calm, and many satisfaction you will find in this mother. If I'm very forcing in my country, in Iran, for waterbirth, it was because most of the mothers, they were keen to have cesarean section. They didn't like to suffer any pain, and they didn't like to have any perineal muscle trauma. So how we could convince them to go through for normal birth? With waterbirth. Waterbirth give feeling of relax and happiness to mother. So they will try to go through that for normal birth. Don't forget, very experienced midwife for waterbirth, not just anyone who is not from the profession. Waterbirth is not that much easy that you think, because you have to consider and monitor all of details of labor progress. If you want some things not progressing well, you have to estimate and you have to recognize to stop it and remove mother from the water and continue her care in the bed. So try to learn about labor, management of physiologic or optimal birth, and then you can be a good expert for waterbirth. Sometimes the mothers who come in antenatal classes, they like to try for waterbirth, but when they enter in the time of active phase of labor, they're avoiding from water and they don't like to continue anymore. It doesn't mean that everybody can be a good candidate for waterbirth. Of course, all low-risk mothers can be a good candidate for waterbirth if they have a facilitated hospital or some countries' birth center and professional midwives. So, what do you mean birth? Tell me. What is waterbirth? Who can opt for waterbirth? Why should we opt for waterbirth? Why are some people creating a confusion between labor in water and birth in water? Have you ever think about that? Some hospitals, they are trying to use the word and termination of waterbirth to attract clients in their hospitals. But they don't cooperate with midwife to have birth in the water, just labor in water. We have to clarify to mother, very honestly, this is labor in water, this is waterbirth. Lots of people I met in these old years, owners of hospitals, CEOs, head of maternity wards in different places and countries. They have been talking a lot about waterbirth, and some professions and hospitals made lots of effort to make this opinion a favorite to attract mothers in their hospital, but didn't succeed. The facilities are not the only prerequisite for waterbirth. You need to have an expert to take up this responsibility. We need to educate the expectant mothers during their pregnancy so that they understand the difference between labor in water and birth in water and pros and cons of it. Most of the people try and make it confusing for expectant mothers so that they don't have an idea what actually it means. I will take one complete session to explain about waterbirth and labor in water in next session in our midwifery training happening from 3rd June. Interested participants may register with us for these individual classes for experienced midwife. You are most welcome, and you will get different information, different experience, different practice from good expert midwife, how they manage waterbirth. Some countries, they are not allowed to work as or apply water birth in birth centers. In some countries, we can only work in hospitals, but we have some restriction about that. And in some countries, you can apply water birth at home as a home birth. So try to join us for these classes. If you need any more information, you can write your comments. We will provide you with details of the classes. Please take care of your passion. My passion always was water birth because I was national swimmer and I enjoyed every time with water. My happiness, my fear, my anxiety, my depression, my sadness, everything was going off by water. That's why I believe in water birth. And every country I was trying to prove it is one important need for women to enjoy from their birth. Try to feel the happiness and positive energy of water in this moment of miracle. I am with you. I am with you. I support you, and I will try to share as much as I can. Don't forget, very experienced midwife for water birth. Not just anyone who is not from this profession. Thank you so much for joining us and spending time with me. Try to keep in touch, write your comment, suggestion. Please prescribe us in our YouTube channel, Lily Mom Center LMC. Please press the subscribe buttons and share these classes if you want it knowledgeable for yourself with your friends. Thank you so much for this day. Thank you for all of these waves. Thank you so much for your lovely comments. Thank you. And I hope we can have our classes every alternatively day. So try to join us in our classes, and we will learn. You will learn many things from different midwives about VBAC, water birth, twins delivery, complication of pre-labor, and NRP, neonatal resuscitation. Have a great time ahead. Love you. Bye.